Hello everyone, and it's another super interview today, and I'm so pleased because we've got Julie Bartlett here today, who has helped me with my own understanding of my physical body. I've done some small amount of training with her. When I met her, she was a fitness trainer and helped me a great deal. But she's gone on to work with women's issues in the sense of a holistic core restore. Now, what's that? We're going to ask Julie what that's about, because pretty much every woman needs to know what Julie can help us with. And I've invited her on today because of her expertise in this area and her wealth of knowledge. She has also contributed to my book. Do you remember this? I've shown it to you a few times. So Julie's one of the main contributors down here, and she talks about how we can help ourselves to be physically fit, active, and happy with our lives in a very intimate way as well. So I'm going to pass you over to Julie. Julie, I don't know how to describe that sensitive subject that we're going to talk about. What would you say?
Thank you, Victoria, and it's lovely to see you, and thank you for everybody taking time to listen in and watch as well. So yes, I've known Victoria for years and started off as a personal trainer many years ago, been in fitness over 30 years now, but over the last 10 years, I've really concentrated on women's pelvic floor health and overall wellness. And people are quite surprised when they meet me now, because I talk about vaginas so often now and the problems that go with it, that it's like just talking about my hand. You know, I can just mention that word with such ease. And when people come to me, it isn't something, they may have been going through all sorts of things, and it sometimes takes them a while to feel confident and comfortable with me. But I'm very proud to say that after working with me for a few weeks, in the end, they become the same as me. They can tell me anything and everything, just the way they would about any other body part. It is a very sensitive subject. And I think for a lot of women, it actually can be quite debilitating, really, in their lives. It stops them doing a lot of things they love. People stop exercising because of leakage. People stop having sex because of dryness, because of painful sex. People stop going out for long walks because they're worried that they might go from A to B, but is there going to be a toilet on that journey? Are they going to have to go behind a bush? Are they going to... And they stop drinking things like coffee because they think, oh my God, every time I have a coffee, I need to pee 10 times afterwards. So it can really, really take over their lives. And then what happens? The bladder loves the fact it can just go whenever it wants to, because you've switched off from that area and you allow things to happen. So there's a lots and lots of things that I help women with: retraining their bladder, helping them with stress incontinence, urinary incontinence, vaginal dryness. And believe it or not, that can be helped with different products, but also with more estrogen. It can be helped with some of the foods that we eat. So there's lots and lots of things that I help women with down there. So you can introduce me however you want. But my main area is the pelvic floor, but I am known as a holistic core restore coach. And there is a massive international body of holistic core restore coaches. And you just have to type in online, holistic core restore, you put in your postcode and it will tell you the nearest coach to you. I'm down here now. I'm down in Margate now, talking to you today. And I know we met in Gravesend, but I'm down here in Margate now. This is where I live. But I still work with a lot of people online. A lot of people don't think it's something you can do online, but I've had fantastic results with people online.
That's interesting, because I assumed you weren't any longer working online, but it's a great boon if people can come across you and talk and work with you from a distance.
Yeah.
I know that you're a wellness coach and women's wellness coach, and men do suffer with incontinence, etc. as well. But it is a very much a female issue, and it can touch all ages, can't it, Julie?
Yes, it can. And interestingly, you've just reminded me of something. A couple of weeks ago, I had to have a visit to the doctor to have a blood test done. And a young nurse in her 30s, we were talking about exercise. I was there in my exercise gear, and we were talking about exercise. And she said, "Oh, I love doing Zumba." That's what it was. She said, "Oh," and I'm totally uncoordinated, can't do anything like that. So I said, "Oh, you know, how'd you get on?" So she said, "Oh, I have to wear tenor, ladies." Wow. And she was definitely only in her 30s. So I said, "Really? You shouldn't have to wear tenor, ladies." And she actually did not like me saying that. Mm. And she said, "My daughter is only 2 years of age. We all wear tenor, ladies."
Yeah, and I think you've touched on something very important there, because a lot of people women spend a lot of money on sanitary protection all their lives, and then when they hit menopause or pre-menopause, or like say they could be early menopause, for whatever reason, childbirth, they end up having to buy protection for urinary problems. So we can spend all our wages. It
is really expensive, really expensive. But what I was shocked about was the fact that this young lady was accepting the fact that she tiddles when she's dancing, when she's doing something, but wear a pad, let it soak it up, and let's get on. And I said to her, I said, "Well, I hope you don't mind me saying," I said, "but if you continue just accepting that you leak now, at your young age," I obviously didn't know her age, I said, "at your young age, that will not improve." She said, "Oh, I'll do something about that later." And I tell any of you that are watching this now, if you are starting to leak, you need to do something about it now. It may be common, but it's not normal.
And how do we know it's common though, Julie? Because I don't know many people that would talk about it. I know when I had a fibroid many years ago, which was operated on and removed, but it affected my bladder, and I was constantly going to the toilet, and that's how I began to realise that there was something wrong, because I needed to pee all the time. Yeah. And so if you spend any time with someone and you're shopping, you would notice that they are going to the toilet, looking for the toilet, not feeling comfortable. And yet we still don't talk about it, and nobody's going to, I mean, in that situation, it was a particular health issue. But, you know, as we're getting older, I'm getting older, I've noticed that there's a change. And as I understand, the drop in estrogen actually affects the elasticity of the floor, as I understand it. You might tell me that that's not quite right, but so that's not necessarily something you can help with exercise. How would you approach that particular problem if it is an estrogen problem? How does that work?
Right, so that's, I mean, you're exactly right. The lack of estrogen causes things like dryness, can cause irritation of the bladder, can actually not make you pee more often, but it's something that you sort of notice in doing that. So there is something that can be done. Don't think that there isn't anything that can be done, because there is. The pelvic floor does lose its strength in holding everything up. The pelvic floor is connected from your pubic bone to your coccyx bone, so from your front end to your back end, and it actually holds everything up. And as we get drier and lack of estrogen and our hormones change, it can become a little bit less strong, so it can lose its strength. It can become a little bit stiffer, a little bit harder, so it uses its ability to come up and down. But we can do something about that. Like anything, we lose strength in our muscles, in our upper body, our lower body. But because we're picking things up all the time and moving them, we're maintaining a little bit of strength. but we lose muscle year on year. So it's really important we also do some resistance training, whether it's with a band, whether it's with some weights, whatever it is, whether you pick up a couple of water bottles every day. And it's the same with the pelvic floor. Use it or lose it. Yes. So you've got to just learn. And this is what I do. Part of my role as a coach is teach people to strengthen their pelvic floor, to lift it up, to lift it. And a lot of people, particularly if we're talking about older ladies, that as we age and things don't work as well down there, we're not as sensitive, we don't feel as sexy, we don't feel as sensual because we're not having the same sort of feelings down there. As I said earlier, you start to pee more often, things you can't hold on as longer as you used to, so you might get a bit of urinary urgency. So because that makes us feel unhappy about down there, we try to disconnect with it. And the brain and your nervous system and your muscles all work together. So one of the things I quite often have to do is say, come on, don't disconnect, let's reconnect. And when we can reconnect and start measuring and sort of really focusing to how many times do you go? A lot of people, I call this the key in the door syndrome. You might be out shopping, you might have gone for a walk. As soon as you put that key in the door, your brain says, we need to go, we need to go. Your bladder says, right, and you put the key in the door and you're trying to put your shopping down, whatever it is that you're doing, and you're desperate to go to the toilet. I know this happens a lot with people. That can be worked on. You can retrain your bladder. And I have had key in the door syndrome. So I know what it's like myself with the key in the door syndrome. When I had struggling with urinary urgency and put the key in the door, and immediately I would just signal. My bladder said, oh, she's putting the key in the door, we need to go. But I didn't really. So I used to just put the key in the door, ignore, and I used to sit down, look around, count 1, 2, count to 10, look at anything. It's distraction. Distract yourself. If you've got a dog or someone comes to greet you at the door, go to them first. Don't let the bladder take over. Don't let that happen. Get control back by you controlling it from up here. It's your thoughts. If you keep giving into it, it will be just filling up a little bit, letting it go. The bladder can hold a lot of liquid. Let it get back to doing its job of holding that amount of liquid that it should be doing. Don't let it.
That might be a little bit, that's going to be uncomfortable, isn't it? To actually start training, but it's obviously you're going to get through that and get you retrain your bladder. I think that's really important.
It's going to be very uncomfortable, but think about the first time you go to an exercise class, the first time you go on a bike, the first time you go on a long walk. They are uncomfortable at first, but you can then, and you may have a couple of accidents. You may have a couple of accidents, but you're at home, but you need to go through that go through that retraining of them if you've let it go too long.
Yeah, because there's a lot of freedom in not worrying about where you go to the toilet and not thinking about it all the time. I know pregnant women, you know, they're introduced to that feeling, aren't they, with all that weight of the baby. And I think that was what was happening with me, was the fibroid was quite big and it was pushing down on the bladder. But so there's a lot of embarrassment around this. Do you find people can talk to you quite easily once they've got that confidence with you, or is it still something that they have difficulty finding the words for?
Once they've got the confidence, and I'd like to think that I help them with that as well, the way I can freely speak about it. I did a talk a couple of weeks ago for a group of women that have been meeting together on a regular basis at a local church hall for many, many years. And the youngest was 72 and the oldest was 94. Now, I thought they won't want to talk about pelvic floor at that age. But so what I did, I incorporated my talk about pelvic floor amongst other things. And a few people were, you could see them looking down and almost cringing as I mentioned a couple of things. But after a little while, I could see them sit back more comfortably in their chair and start to, can I just ask? Can I just ask? And at the end of my talk, honestly, Victoria, I had a queue of women wanting to talk to me personally.
Because we don't talk about it. Even amongst friends and colleagues at work, we just don't talk about that, because I suppose it isn't dirty, but I suppose people do think it's unclean and perhaps not necessary to talk about. But it inhibits your sex life. If you're sick and ill in hospital, you're going to be covered in incontinence pads. You're going to be treated like a baby. You know, I can imagine all sorts of horrors if you get older. And I remember you saying to me once, Julie, you said to me, it was over a dinner table when we were having lunch with friends, and I remember you saying every woman needs to have bladder control, because if you don't work on it, you'll have none. And I thought that's a very extreme thing to say, but I thought about it a lot, and I thought, I'm sure that a lot of people I'm with all the time have problems with leakage and worrying about what they're wearing, etc. But again, it's not something you can bring up very easily. But I think you could be right. And I think you probably are right. And if you think of the longevity we've got and how much of a chance there is that you're going to end up in hospital or sick at home with other people looking after you, you don't have to be that old.
No. And the thing is, we are living longer. We're living longer, as you know, the world, we're all living longer because of everything, the way the world is changing, you know, the technology we have and so on. So whereas some people may have thought, oh, well, I'm in my mid-60s now, so, you know, that's okay. Well, they could have 20 more years from I hope I'm 64. I hope that I'm going to have at least 20 years. I don't want to not do anything now and then be spending, and it can be thousands of pounds long term in spending on those products, the 10 a lady type products, thousands of pounds. They are not cheap. And I see it when I go in the supermarket and people have it in their trolleys, you know, that they're buying boxes of things, and it's cost them a lot of money. And I just want to, me and all the other holistic core restore coaches want to spread the word. We do group courses, and I am getting people younger, but I'm also getting people older now. I had, my last course was filled with people 60s and 70-year-olds. That was brilliant, because they wanted to do something about it. And also, and like you say, not everyone, in my world, everyone talks about it, because we're in fitness, we're in wellness, we don't mind. And friends that know me and friends of friends, oh, you've got to talk to my friend Julie Bartlett. So I've got people that ring me up and quite embarrassed at first. Prolapse is a big thing now.
Yeah, but also there aren't many people. I mean, I see a lot of PT instructors, and you can go to the doctor and talk to somebody there in a clinical setting, but not many PT instructors or people like you sort of have that as part of their advertising or their promotion, or have it as a bullet point as that they can cover. So I think perhaps there is a communication need, that we need to know that there are people out there that we can easily access. You know, there needs to be more like you, Julie, really.
Yes, and there are, but like you say, people need to know that there are people like me around, and hopefully that will be more in the future. I'd love to see the future with people like me all across the country going to schools, going to secondary schools, and teaching young women early on about their importance of the pelvic floor. Because at the moment, what happens, young girls don't know that. I've had a girl as young as 13 that had urinary incontinence and stress incontinence and frequency. So she had them all at 13. Yeah. And hers was because she wouldn't use the school toilets.
Yeah.
So therefore, she was causing the bladder, the dysfunction herself, because she was holding on to it for too long. And then the bladder was saying, I can't do this. I'm trying, but I can't. And then the little jump or a skip in the school in PE was causing it, having to go straight away after. So anyway, we sorted her out. Yeah. Then there's childbirth. After you've had a baby, all they say is, oh, could you do the Kegels? Squeeze the vagina, squeeze the vagina, squeeze the vagina. You'll be all right, but keep doing that. But that's not enough.
No.
That's not enough. They've got to learn squeeze, draw in, pull up to strengthen the whole of the core, the front, the back, the sides, the whole of your middle needs strengthening. And again, they haven't got enough time on the NHS. When you see the midwife, she's going from one person to the next. She hasn't got enough time to teach you. But really, we should be the next point to say, right, okay, now you've had your baby, you need to do a holistic core restore course. It will be brilliant for you.
So will you be looking at setting up some training? Is there a way of developing more training for women? They're interested in what you're saying, because hopefully, you know, you're in the book. I'd love to get, this is Rejuvenate Your Life, everybody, in case you haven't seen it. And Julie's a contributor about pelvic floor issues. But you know, where is the new generation coming from? Where are all these trainers coming from? How can we get that? Can we get you out there talking more and promote your event, for example?
Yeah. Yes, that's the sort of thing it needs to be. It needs to be that we're actually you can search for us now. People are starting to know, but we also need to get more into the NHS, so the NHS know about us and say, like I said, that step. We're working on it. Yeah. And I feel it will be the future, definitely. I'm doing more talks. I give more talks for all different
organisations. And
thank you.
Yes, I know. It's just that age.
There we go. But yeah, for organisation, I go in to help the aged and do free talks in there. And like I said about the anyone that really wants me to go, because that helps to promote it. So that
and you've got an event coming up, haven't you? I wanted to mention that to anybody that's watching this, that Julie does these wonderful events, and you're taking part in a retreat, a day retreat, focusing on these issues. Is that right?
One of the things that, again, later in life that women struggle with, and again, and urinary problems, which a couple of things you've mentioned there. One is about my event. We're doing menopause day retreats now, and we look basically about the life laundry. This later stage in our life now is all about looking at things that no longer serve us well and looking at things that we can bring in that will serve us well. It's no good doing what you've always done and getting the same result. No. So it might be that you need to make some changes. And those changes are what we discuss on our day retreat. And the next one I've got is the 5th of March over at Nurstead Court in Mepham. And it's a day retreat from 10 till 4. And we cover everything to do with being a woman, going through the perimenopause, the menopause and postmenopause. And you get a lovely Sunday lunch at Nurstead Court. I love this Sunday lunch.
For everybody, Mepham's in Kent.
Mepham's in Kent.
But so if it depends when you see this recording, when you see this interview. But Julie's going to leave her details, and I'll post them with this interview when it goes out. But Kent is a lovely part of the country, and if you come down this way, Julie's based in Kent. And Mepham is a lovely village, isn't it? And you live further down in Westcliff area?
I live down in Margate.
Margate,
yes.
Down there. So
by the sea.
You don't mind travelling then?
No, I don't mind that at all. I travel up for that event because there's a lot of people around there that I look after, so it's quite good to do that. But these will be on a regular basis. So it could be, and also sometimes companies pay for people like myself to go in and do a day during office hours. So it could be someone watching this that think, oh, my company might like that. Yeah. So, tell me, I can come in and we can do it in the comfort of your own workplace.
I think you've hit on something there, though. I would say to everybody that's watching this is an issue for all of us. That's come across very strongly. And also, it's nothing to be ashamed of, and we need to deal with it. Women need a voice, so we need to ask for help. We need to ask for these solutions. We need to ask for more training. We need to ask our employers. We need to ask our local groups, you know, and make sure that there's a demand, because then the demand will be fed. All the while we're being quiet about it, it's we're just setting our own children and our daughter-in-laws, all our everybody.
It's just going to continue on. It will continue on.
Yeah,
and I'd like to think the next generation following us, they will have better knowledge. They will have better access to people like myself, that they can then think, right, okay, I'm feeling something's not quite right. I'm going to do something about it. Yeah. And the same what we were saying about, you mentioned about the book, and in the book, Rejuvenate Your Life, that I was very happy to contribute to, there is a section at the back. My particular section does help with this pelvic floor work. I take you through step by step to strengthen your pelvic floor.
There's also a very good diagram.
Yes, that's how all our organs should be, up like that. This is from the Burrell
Foundation or organisation, but it's such a good diagram, because you were talking just now about, you know, we've got to get all these pieces to work together, and other than that it's a sling across the bottom, it's kind of like hard for us to imagine. You know, we've seen all the diagrams of babies in the womb and everything, but we don't really understand the anatomy. And so that diagram is essential to this part of the book that you've put in there, and talked about these issues. And so I think that putting it into a picture, when we can feel things, but if we know that it looks like this and it's connected to that, it helps. So it's a marvellous job you're doing, Julie. Really.
Thank you. Yeah,
really.
I do think education is the key, and lots of women who have had, and I show that in keeping the organs, you've got your bladder, your uterus and your bowel, and they're all kept rather nicely up, for some people forever, for some people not forever. And a lot of people who have hysterectomies, you take away that middle organ, you take away, particularly if the full, everything's taken away with ovaries, which happened to me because I 10 years ago had early detection of cancer in my womb. So they took the whole lot out, thankfully, with the uterus. But that left my bladder and my bowel with plenty of room to move around now. It wasn't kept there. So what happens, that sometimes the other organs that are left behind have more room to come down. Hence that leads to prolapse. Myself, hands up, I now have a prolapse because I continued to do the sort of strength training that I was doing, not really giving thought to these two organs, my bladder and my bowel, having all this room. So what do? It starts to move across. I'm dealing with it. I'm dealing with it with exercise, with my own knowledge, and exercising every day to keep that pelvic floor, to stop that bowel from coming down too much. But some people, they're not strong enough, or they don't have the knowledge that I have.
And I think it's guidance. It's guidance to know that you're doing things correctly. But I also had a hysterectomy, and I remember feeling very empty and very light. And it didn't occur to me that everything had to fill in the gap. So I understand what you're saying. That's brilliant. So I think we've had quite a lot there to think about, and hopefully everyone that's watching will think about yourselves, think about other people around you, think about those coming up, and maybe help people like Julie and some of those that she's working with to ask for change, ask for training, ask the doctors. When you've had a baby, ask for more support, not just a few exercises. And I think also, Julie, could you tell us how everyone could get hold of you? How can people contact you?
Yes, if I can leave with a couple of tips for everybody watching, if that's okay.
Yes,
so just a couple of tips that I would say: don't always give in to the first signal of the bladder. All right, so just try to put it off sometimes and retrain your bladder. don't always go for what I call, and sometimes as parents we're guilty of this, when you say, does anyone want to go to the toilet before we go out? I call them sometimes jigs, just in case wheeze. Try not to regularly do a just in case. Try to let the bladder do its job of filling and emptying. Seek help if you need it. All right, seek help. I don't charge anything to have a little chat about it, and I can maybe point you into the right direction. So you can reach me either through my website, www.juliebartlett.me. I'm also on Facebook, Julie Bartlett, on Instagram, juliebartlett.me. And I have an email. I don't know if you put out, do you put out email addresses, Victoria?
I will put everything on with this when it goes onto YouTube and when it goes out into the social.
If anyone, yeah, I'm happy for that. If anyone would like to email me, please do. But
yeah,
please look after your bladder health, your pelvic floor health. And if any guys are watching this as well, guys, same thing applies. Watch out for those jigs, those just in case. Guys, watch out for any, you know, nighttime. My husband, myself, he was getting up and down 3-4 times a night. Guys, girls, you do not need to do that. Retrain your bladder. It should not have to. You shouldn't have to keep waking up to go. Your bladder should hold that. So again, that's something, retrain, please.
It's a nightmare, really, that to think that pretty much most of the population have these problems at some point in their life, especially in the latter part of their life, and it ruins the quality of your life.
Yes.
If you can't do the exercise, go for the walks, go shopping, go out in the evenings, can't lose all your confidence about what you're wearing, etc. You know, I mean, just to finish, Julie, for me, one of the best things in life was menopause, because I looked forward so long to not having those monthly visitors and to be free. So the sort of then having to think, like, oh, Darren, moving into tenor, or later on I'm going to be incontinent, it's just a nightmare. So thank you so much for sharing all this with us, for breaking the taboo about talking about we.
Yes.
We pee. We can say lots and have a laugh about it, but it is a very serious situation, and I'm so grateful that you're around and have the training. So thank you.
Yeah. Thank you. Thank you for having me. Brilliant.
Thank you. So, yes, please do look out for this soon. Go to Julie if you have any questions, and make your demands known that we need help and we do not need to live like this. So I'll see you all again soon. Cheerio, everyone.
Bye, everybody. Bye.
Thank you, Julie. Bye.